On behalf of AOPA's board and staff, I wish you and your family a blessed Thanksgiving. It's my final week as AOPA's president. As I reflect back on my term as president, I'm exceedingly grateful to everyone who has supported me, our board, and AOPA staff during this pivotal year as we transition to new executive director, Terry Kupple. Unlike prior executive directors who came to AOPA with a background in association management, but no experience in O&P, Terry's proven track record and expertise as an O&P clinic owner, lawyer, O&P educator, and state and federal advocate for our profession made her an ideal candidate to take the reins of it at AOPA. Additionally, her 8 years of volunteer service on AOPA's board, including her term as president in 2023, gave her tremendous insights about the organization and the services provided to members. Terry has done an amazing job these past 12 months, and it's been my pleasure to talk, email, and text with her nearly every day this year. Terry led an internal assessment of the association, quickly identifying opportunities to optimize our human and financial resources to better serve our provider and supplier members. One of her key priorities is to ensure staff are more proactively engaging with members, including in a member's workplace, to better understand their needs and challenges. She is also stepping up AOPA's collaborative efforts with national and state O&P organizations, as well as with other health professionals. Terry is also committed to expanding AOPA's visibility and outreach to young emerging leaders in our profession and to O&P students who are the future of our profession. It has been a busy and productive year, a transformative year. It was also a successful year in terms of the organization's financial health. We exceeded our budget objectives and substantially grew our financial reserves, while also donating $200,000 to the O&P Foundation to support research and education that will benefit our profession in the years ahead. Throughout 2025, AOPA worked closely with the Amputee Coalition to support So Everybody Can Move. We celebrated policy wins achieved in several states. More than a dozen states have now passed legislation that expands coverage for recreational prosthetic and orthotic devices. New advocates continue to join this movement to help achieve the goal of passing legislation in 28 states before the 2028 Paralympics. I want to thank all the members of various committees for their volunteer service this year. I also want to recognize and thank the 4 clinicians who serve on our board, Jeff Ehrenstone, Deanna Fish, Andy Steele, and Dr. Shane Wardeman, as well as our 2 clinician educators, Arlene Gillis and Adrian Hill, and our 2 business executives, Shane Kelly and Jim Kingsley. And a very heartfelt thank you to the board members who served on our executive committee this year. Our treasurer, Chris Nolan, vice president, Matt Swigum, our immediate past president, Mitchell Dobson, and president-elect, Kimberly Hansen. You all put in the necessary time to achieve the goals we established, and we'll all miss Mitchell's contributions as he rolls off the board. I hope you will join me in welcoming Kimberly as she begins her year as AOPA president. I didn't know Kimberly when she joined the board, but after working with her these past 6 years, she's become a trusted colleague and a friend. Kimberly is a proven leader in our profession, serving as Ottobock's Director of Reimbursement for North America. She's extremely passionate about O&P advocacy that ensures fair policies and reimbursement for O&P care, and she was a driving force in expanding coverage of microprocessor knees for K2 patients. I hope she enjoys her year as president as much as I did, as it was truly my pleasure and my honor to serve in this role. Have a blessed Thanksgiving with your family.